This next exercise we'll be looking at is for those people who have an excessive arch in their lower back. So excessive lordosis or hyperlordosis. The degree to which an exercise in manual therapy is likely to make a difference to this area will be partly determined by how much of the cause is the anatomical structure, the bone structure, what you were born with and grew up with through childhood, and to what degree this is being affected by how you move, your posture, and therefore the muscles in this region of the body and this region of the body. So the muscles of the anterior and the posterior core. The exercise we're going to use is often referred to as cat-cow, although we're only going to be using a small portion of the movement normally done in that exercise. There are a number of ways you can load this using bands. The first clip you'll see following will be using a dip belt and some bands attached to a power rack. That's probably the most comfortable way of doing it because the belt is nice and broad across the back. The second option is using a single band, again attached to a power rack, but since many of you won't have that either at your gym or at home, the third option is simply using a resistance band that goes across the back and the knees, and you can really do that anywhere. The key thing is to make sure the belt or the band are in the right place. So above the sacrum, above here, and below the thoracic spine. So really in this region here, that's the area we're trying to affect. And you'll notice in the videos, what we're trying to do is simply flatten out the lumbar spine. So this is not an exercise to be done by those who already have an excessively flat lumbar spine or who have normal lumbar lordosis. This is for those people who have that excessively arched lower back. This is probably the most accessible option to most people, but also the least preferred overall, because using a narrow band is going to make it hard to distribute the resistance across the lumbar spine. The way you do this is simply place the band under one leg, across the back, and then under the other, making sure it's in the small of the back, and then simply repeat.